Hi, everyone. Welcome to Reach Live. I'm Reena Sangar. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency, and we research all the new developments that are happening within this fast-paced industry. It is an honor for Ipsos to be a partner of Reach Thought Leadership, and for me to host Reach Live on the last Friday of every month. At Reach Live, we bring thought leaders from across the digital health ecosystem to come and share 30 minutes with us and have a conversation. And today it's a pleasure to have Pat Dunn from the American Heart Association, who truly is doing some fascinating work within the connected health space. So without further ado, I'm going to welcome Pat and ask him to introduce to you all his role at the American Heart Association and what focus area he has before we get started. Hi, Pat, welcome.
So again, my name is Pat Dunn, and I'm the Program Director for Connected Health for the American Heart Association Center for Health Technology and Innovation. My background is in cardiac rehab as both a clinical exercise physiologist and a program director. So I'm kind of part healthcare professional, part health educator, and also partially a software engineer. I'm especially interested in the role of technology solutions in building health literacy skills so people can better understand and manage their health. And I really have a fun job because I'm kind of a connector between the tech world and the clinical and scientific world. So I work directly with basically the chief science officers and the technology officers in these tech platforms. And frankly, it's helping them get the science right.
Love it. It's going to be a fun talk. There's lots to uncover there. Bringing science and tech together is quite a feat. Tell us more about that. What does your role look like in practice? What are the types of things that you're doing? And yeah, a little bit more granular would be great.
Sure. Let me tell you a little bit about our center. So the mission for the American Heart Association is to be a relentless force for a world of longer and healthier lives. So note that it says nothing about heart and nothing even about American. This is really a global initiative. And our approach is really digital first and equity for all. So we have to have a digital strategy. Our center was created 5 years ago by our CEO, Nancy Brown, as really a center of excellence for tech and innovation. So our goal, like I said, is to be kind of a connector between the tech world and the clinical and scientific world. And frankly, it's helping the tech world get the science right so that the tech that's being used can actually improve health and achieve better health outcomes. We do that in a couple of ways. One is, several different roles. One is as a convener, really getting all of the different stakeholders in this ecosystem, and not only the techies and the scientists, but even the people responsible for reimbursement, frankly, the patients as well. So bringing those groups together, trying to get them on the same page. Also, just delivering science and content. Over the past decade, we've been developing a series of what we call digital care plans that are based on our science, and they're literally built into a back-end engine that can provide resources and content both to consumers and patients, as well as to healthcare professionals. And again, it's to make the job of the tech world of getting having better high quality science from a trusted source. In some cases, we actually co-create with some of these tech solutions, and we actually build on our strengths. A couple of examples: we co-created a program called Heart and Mind with Happify. Happify is a mental health platform building on their strengths in mental health and our strengths in cardiovascular health. We've done a couple of other examples. We built a program called a health motivation platform with a company called Patient Bond, which is really focused on what's called psychographic segmentation. And then finally, research. It's really hard, but really important to have really good health outcomes for these solutions. And so, and frankly, data and information that will resonate not only with patients, so they believe that they can benefit, the professionals that are managing the systems, and then ultimately the people who are paying for them. So we kind of guide these tech solutions into basically providing better science. So it's not just, hey, go check out my blog, but actual studies with credible evidence and analysis behind the scenes.
Fantastic. It's so Pacific and rich in that sense. You know, I hear about a lot of different types of collaborations, but I'm really impressed with the work that the center that you run are doing, because it's some really tangible things within it. And for me, the care plans is like, yes, this is what's needed. You know, when we're looking to develop tech solutions, and cardiovascular health has been one of the prime spaces, of course, for tech innovation. But understanding the patient journey, the diagnosis, the treatment pathway, the moments which are difficult, the compliance struggles that happen from the different areas of the hospital system that it affects. How could someone engage with you on the different areas that you talked about, from convening to co-creation to having access to these things? I'm sure there are listeners who would want to know, like, well, how do I engage with you?
Yeah, great question. So we have what we call an innovators network within our center. And there's a couple of different levels of how companies can engage with us. One is just frankly being part of the club. So those are the innovators, and they participate in our events. We have a health innovation pavilion, for example, at our scientific sessions, and we participate in other meetings, you know, throughout the year. So we love to bring our innovators along with us to do that. We actually collaborate sometimes on grants and other solutions, other bigger types of things. We do have an integrator level, which again is where some of these, you know, accessing the content and building these care plans into their own platforms. It's all a back end. Well, we're not creating an end-to-end solution. What we're creating is the back end, and they can build through an API these plans directly into their platforms. And then the final level is really the co-creation, where we actually build something new based on the uniqueness of the collaborations.
Fantastic. Yeah, I think it's just so great. And I believe the future for us to really transform health is in partnership. But the heart of everything you're saying is about a partnership model.
I mean, we're not a technology company, and we're never going to be one. We're never going to be able to stay up to date with all of the amazing technology that's out there. So rather than trying to build it ourselves, you know, it's frankly a much, you know, better strategy to just work with what's out there and really try to add value to those platforms by bringing richer science to it.
Yeah, that's what I love. I absolutely love that. And that's what sits you so interestingly between the two areas. You talked about Pilify Health and also another, the patient bond piece of work that you did. Talk to us a little bit more about the collaboration, if you can, to point possible. I'm really intrigued with, well, how did it work? Like, what was the type of work that you were doing? What's the practical examples of it? What can you share?
Yeah, so it all starts with, where are the gaps? So in the case of Happify, you know, we clearly see a gap in that intersection between cardiovascular and mental health. You know, there's a lot of people with heart disease that, you know, they suffer from depression and anxiety. And frankly, it would be unusual if you had a heart attack not to have a little bit of depression and anxiety going on. So it's really trying to close gaps in those areas. Patient bond was another example. You know, it's one thing to create all this cool stuff, both from a tech perspective and a science perspective, but if people aren't using it, then it's kind of a lost opportunity. So it always starts with, you know, what are the gaps? What are the problems we're trying to solve? And then from there, it's, you know, working directly with their developers and their scientists. And again, I have such a fun job because I really stand on the shoulders of the entire organization. You know, we have, you know, literally the world's experts in, you know, a lot of different areas, not just, you know, traditional heart health, but we really cover the gamut. We have a number of scientific councils, we have journals, we have conferences. So, and, you know, obviously the scientific volunteers that support us. So that's the fun part of my job.
Yeah, absolutely. And, you know, you talked about mental health, behavioral health. It is the need of the hour. You know, we talk about stress, mental health burden that's happening right now, and the impact that, mental health has across all disease states is incredible. And we've seen it time and time again. So bringing in these solutions, embedding them within other treatments makes absolute sense. It just makes absolute sense to me.
Yep.
I want to talk about health equity.
Yeah.
It's something that I know that you're particularly passionate about at Reach, as Reach Thought Leadership. It's a huge area of focus and passion for us. We believe that we need to work on equity to give everyone an equal chance. And we've got to remember there are barriers to that for the reason that, not everything is equal stand. Just because it looks like it is, not everyone is accessing services at the same level. We have very different reasons for that. So talk to me a little bit about the stand and the work that the American Heart Association are doing, particularly around health equity.
Absolutely. So to achieve our mission of longer and healthier lives, we frankly need to cross the digital divide. So, technology can be part of the problem, but it does have the potential to be part of the solution by providing better access to healthcare and healthcare services, and by democratizing access to health information. So a good example, we have a program called Doctors with Heart, and my colleague Cassie Walker really manages that program, again, in conjunction with a lot of our volunteers. But it's a way to provide specialty consults peer-to-peer, so it's doctor to doctor, for patients that don't have access to specialty care. And so basically what it turns into, it's a mentoring program where, a cardiologist that's part of our network can then give, advice to, a primary care physician that's working maybe in an FQHC out in a rural area that otherwise might not have access to that level of care. So again, with our goal of equity to all, it's really, making sure that the technologies that are being developed are not just being developed for people who can afford expensive gadgets. It's really designed to drill down, one of the principles that we use with this is our focus on health literacy and digital health literacy. So we know that health literacy tracks with social determinants of health. We can't change somebody's race or their income, but we can help a person build their knowledge and skills that they need to manage their health. And quite honestly, it's more than can I spell cholesterol? It really is several stages from understand, and we can use blood pressure as an example. So the first level is understanding the problem. So understanding blood pressure and why it's important. The next level is understanding the numbers associated with it. So if I take a blood pressure reading, I know what range those blood pressures are in. The next level is, if it's high, what do I do with that information? So how do I navigate the system? Do I call my doctor? Do I dial 911? Do I take more medicine? The next level is once you do get into the doctor, whether it's through a televisit or face-to-face, what questions to ask and what information to share. And all of that should lead hopefully to better decision-making, both unilateral decisions, like maybe I should cut some sodium out of my diet, to shared decision-making, like maybe we need a different plan. So that's really how we're approaching it from an equity standpoint, is really trying to improve access, but also really knowledge is power. The more that we can provide people with that knowledge that they can actually become a more active participant in their health, I think we're all going to be better off.
Yeah, I could not agree more. Really does. When you know better, you do better. Like they're famous words that have been spoken. And I remember my father being put on a cholesterol pill, and bless him, he had no knowledge. He was like,
yeah.
And he was literally taking the role of, I've just got to take this pill. I was like, why? Have you understood why you're in this situation? And more importantly, do you understand how to make a change? But changing behavior is hard.
Yeah.
Even when you have the knowledge, to be quite frank, sometimes knowledge is not enough. Even at the last Reach Live talk that we did with Dr. Himali Patel, who really works extensively in diabetes. And again, that's a huge therapy area for trying to change behavior. I'm trying to think about that. So let's talk about that. Let's talk about how do we have such a high dropout rate. individuals can start, and the engagement levels can be quite high on certain apps and certain solutions, and then we just see this real kind of drop off. So getting people to stick, actually seeing the engagement in a meaningful manner. What are some of your experiences with the work that you've done around that?
Yeah, so again, that's the fun part of my job, is I get to see all of these different platforms and how they work and how they engage their customers. Some are better than others. What we're especially interested in is really what we call the science of habit. Really designing systems to motivate and engage people with the result of better healthy behaviors, not just the behavior of I buy the product or I download the app, but does it translate into a positive approach? So what we've built on top of our care plans is really a digital coaching platform that really incorporates best practices in health coaching, health literacy, motivational interviewing, and psychographic segmentation. What we've learned is that, first of all, it needs to be easy and intuitive. So if it's hard and it's kind of, not easy to comply with, then of course people are not going to comply. It doesn't have to be passive. Like I mentioned, we do want people to be active participants in their health. So they should actually know what's going on, but it does need to be relevant to them. So again, being able to curate systems across multiple domains. People have, a social domain, medical, a lifestyle, but also a learning domain. So really trying to, get the right information for that unique person's individual preferences, and then even take it a step further and really making it as personalized as possible. And that really goes both ways, not only personalized for the patient or the user, like what are their traits, but also for the healthcare professional, like what should their approach be? So, the pretty unmotivated, disengaged, hard to motivate patient, throw in a lot of content, read this article, watch this video, just gives them an excuse to turn it off. What you really need to be is in listening mode, really trying to get that person, frankly, on the right side of the argument. The other end of the spectrum is the super motivated person who, frankly, has questions that a lot of times the doctor doesn't even know the answers to without looking them up. They don't need a whole lot of extra content. They need to be kept on track, aligned, and moving forward. And then, of course, there's people in the middle. Some need more of an emphasis on motivation and compliance, others more on direction, like, what to do. And so to the extent that we can get this right, it can really frame the type of content, the pace of that content, and hopefully, we can come up with better solutions as a result.
I love this discussion because it's to the heart. I mean, segmentation work, persona work, archetypes, our researchers, domain. We love doing these things. We look at attitudes and behavior, and really bring together these individuals that you're talking about, because we exist. Yeah, we're not one size fits all. You can't, really homogenize lots of different folks, but we do need something to work with. And it's absolutely feasible to consider that there are 4 to 5 different persona types in a disease state.
Absolutely.
And it's just, depending on what your solution is you're creating, then you can really start to think about, well, what's your messaging going to be? Like you say, what's the onboarding plan for this person? What's going to be the maintenance? And it's transformative, Pat, and I'm sure you've seen it like me. Like, if you get that right, it can be transformative.
No, I'm completely, drinking the Kool-Aid. What we're trying to do is also, sometimes the weak point is the professional. So the person on the other end of that stream. So also providing better resources for that person on, what should your approach be? What resources do you need? And frankly, if the patient is coming with questions like, hey, I'm thinking about going on a plant-based diet, but I have diabetes and chronic kidney disease, making it easier for that professional to figure out, okay, what are the recommendations in this? What are the things that I should be worried about from a clinical perspective, but then also helping with prompting on, okay, how do I help this person move forward based on a lot of those personality values and traits that person has?
Absolutely. And the other thing that we must remember is that, physicians do need support as well. It's tough for them. There's a lot to learn in this space, in this field. And Ipsos recently launched Digital Doctor, which is a 14-country study looking at what physicians are thinking and feeling. And overwhelmingly, they all want to do better. They all do want to be able to, they do see the empowerment of tech. They believe that technology is an enabler for patient empowerment. They're just not seeing the tangible benefit to them day to day because it's draining their time, and they're not clear about where they should be directing. So there's a whole other, we haven't got the time today, but I tell you, there's a whole other talk to be had.
Oh, yeah.
Just around clinicians.
Well, and not only that, but also there has to be a business model for them. So they may know that it's the right thing to do. They may actually want to do the right thing, but there also has to be the right model in place to make it scalable, frankly, so that, both from the patient's perspective, but also from the professional perspective, so that these things can continue, beyond the grant or beyond the study, and just be embedded into routine care.
Let's talk about that. Let's talk about the move from, and the obsession of pilots that will happen in tech, and there's a lot of pilots, to scalability.
Yeah.
Right? Because we need things to scale. I think you said it really well when we were speaking before as well. You said this phrase around, ultimately we need to see this happen. For it to make impact, for it to make change, it has to scale. And that really stuck with me. And yeah, how are you finding that with all the things we just talked about, showing evidence, having to have reimbursement in place? What's the scalability story?
Yeah, let me use my favorite topic, which is cardiac rehab, as an example. So we know that people who go to cardiac rehab do significantly better in almost any way that you can measure it, yet participation is very low. Now enter COVID-19, and it made it even more difficult, obviously for social distancing and risk and all of that, for people to attend cardiac rehab. We do have a scientific statement that home-based cardiac rehab is as safe and as effective as center-based rehab. This is not man versus machine. This is not, hospital versus home. What we're really looking at is that combination, kind of a hybrid approach, which I think is, so a couple of things on the, the programmatic standpoint, it's, probably some combination of face-to-face and remote. And then also from a technology perspective, again, it's not man versus machine. It's, it's really, leveraging the skills of the professional, but also, acknowledging and leveraging the benefits of the technology. So what I kind of call that human enabled AI. It's, it's really, getting all those forces together to frankly make it, and it needs to have outcomes, clinical outcomes, but also process outcomes that people will actually do this and stick with it. And that is the challenging part, but it is possible.
Yeah. And then also there's been a lot of critique of studies that have been designed and conducted in the digital and connected health space. And it's not easy, we're working in a situation where so much, this technology, it's a software, and, it's not a discrete pill or a discrete item, which is not going to change and evolve. So how have you seen in terms of study design, what's been some of the learnings that you can share for those that may be considering doing randomized control trials to prove out their product or something like that? What's your view?
So the randomized control trial is the gold standard for demonstrating outcomes. Yet these studies are very difficult, because the innovators want to keep innovating. There's numerous examples where the study's been conducted, and by the time it's published, the technology is several cycles, ahead. And so, we really do work with the innovators and frankly, also the researchers in coming up with, frankly, more innovative study designs where you can continue to innovate while still tracking your endpoints. And I know that what I just said is like complete heresy to traditional researchers, okay? Because you're not fully controlling for those variables. But the reality is there has to be a little bit of give and take, in order to come up with really high quality stuff. One of the ways we do that is just breaking these trials down into smaller components, and frankly have stop points at different phases to let the technology catch up. You're still tracking the endpoint, but so that you're always using the most up-to-date technology. Otherwise, you're just reporting on obsolete technology at the end of the day, and that does nobody any good. So it does resonate, but it has to be well thought out, both from the technology perspective as well as from the research design perspective.
Yeah, a lot of people still to convince, I think, but I agree with you completely around it. We have to show flexibility. We cannot be rigid when we're working in such a high innovation space, such a fast moving space. One of the questions, I'm keeping an eye on the chat, folks, and we are closing up soon. To what extent is the American Heart Association developing their own solutions? That's one of the questions, Pat.
There are cases where we do these co-creations with tech innovators. It's rare for us to develop our own completely end-to-end solution, because we really do want to focus on what we're really good at, which is the science. Okay. There are cases where there are gaps that, frankly, because of a fragmented business model, where we do have to step in and develop something so that there is access to that. So, and again, a lot of the focus is on equity. That's a big focus for us, and obviously COVID has really kind of transformed a lot of approaches. Again, one of the long-term impacts of COVID is our cardiovascular complications. So again, even within our own care plans, having more of an eye to infectious disease prevention, vaccinations, and other things, along with traditional cardiovascular disease prevention.
Thank you, Pat. To all those attending, you can find us both on LinkedIn. You can certainly get in touch and ask further questions. There are other things definitely that I feel people want to talk about, and I agree, this is a great topic. But let's close up on the future of health. You spoke about pandemic, of course, so much has happened this last year and more. And the beginnings of a question are coming now about what the future of health will look like. And we've got some predictions at Ipsos too. So I want to hear yours, Pat. What do you think the future of health will look like?
Well, I think the future in COVID-19 has only accelerated this. These trends were moving this way anyway, but healthcare systems will have a digital component. A year into this, we're all familiar with Zoom and Teams and all of these digital platforms. A year ago, that might not have been the case. We're learning, and there's a lot still to learn about how to use technology. It's not in the entire solution, but it certainly can significantly add value to the current situation. And there's a lot of room for building better technology, newer technology, not only on the high end, but also, frankly, on the end of making sure that technology is available to everybody.
The future is certainly blended.
Mm-hmm.
I'm in complete agreement with that. So yeah, it's been an interesting time, and as we speak more and more to doctors and patients, there's certainly been things that we've learned through moving digital that are efficient, that do work well, and even in our own work lives, right, Pat? We've learned a lot. But from the other side of it, the human aspect is always going to exist and stay. But it's kind of knowing how the blend and measure of those two things will be. But with that, just to say to everyone, yes, the talk will be available on demand. There was a question that popped up around that. Thank you for being active in the chat. There's some lovely comments that came through, and it seems like some of the topics, particularly around behavioral science there and stuff, have really resonated. And it is a complex topic, and we've only touched the sides of it, I'd say. So with that, I say, Pat, thank you so much for your time on this Friday. Really, really enjoyed it. And yeah, for everyone else, thank you for being with us. Please do subscribe and follow Reach Thought Leadership. Join us every last Friday of the month, and we will certainly get Pat back again because I think there's more to say. But Pat, over to you for any final thank you.
No, I really appreciate you and research for giving us the opportunity to present what we're doing. Thank you very much.
It's great work. Thank you so much. Have a wonderful day, everyone.